Good morning. Oh, it's so bright. Can never get used to it. How's everyone feeling? Yeah. Okay, let me ask that again. How's everyone feeling? Yay! All right. So, good morning again. Before we get started, just want to go over some housekeeping items. First thing, oh, and I see already lined up against that wall. We know checkout is at 11, so during the break, if you want to grab your suitcase luggage, you can line them up against that wall or on that side too. Uh, Anything else oh, very important. I don't want to forget this. I mentioned yesterday on the back of your program, there is a QR code, and that QR code leads to our program evaluation. Um, this program, the summits, are really designed with you in mind. And so your feedback is really important for us to help plan future summits. So we hope to have 100% participation. And if you have trouble accessing the QR code, there's a link also on the program book that you can type into the web browser. It's a great resource if you're waiting for your plane, waiting for the train, looking for something to do in between the breaks. So hopefully you will do us that huge favor of sharing your thoughts about what you thought about this program and how we can make it even better for you. So with that, I am going to introduce us to the first session, Journey to Survivorship, Insights from Bladder Cancer Survivors and Advocates. On the stage, we have Monica Austin-Cox, Stuart Greenfield, and Howard Sal, who are patient advocates and are here to share their story. There are courageous patients who will allow us to spotlight them today so they can share about some tips and tricks and how they're thriving despite their diagnosis. So, and Stephanie and I will be having a conversation with them, and so we're going to get started. Is this mic on? Okay, I'm going to transition from one mic to another. So hopefully everyone can hear me okay. Instead of me reading their bios, what I would like is for my friends here to introduce themselves. And in your introduction, if you could please share with us your story of what was life before your diagnosis, and then walk us through your diagnosis. And we're going to get started with our rose in the center, Monica.
Rose between two thorns.
Is it? Okay. Good morning, everyone. My name is Monica Austin-Cox. I currently live in North Chesterfield, Virginia. And prior to being diagnosed with bladder cancer, I was just living my life, thinking I'm healthy and doing all the things that we do at the age of 30. It was a series of events that took place prior to me being diagnosed. I never had any symptoms. I never experienced the blood in the urine. Only I experienced a lot of UTIs, but not to the fact that it was a red flag that I need more testing. So I went to my doctor to have just my annual pap smear. And during the examination, she felt something that she said something's not normal. So I'm going to send you for further testing. I had an ultrasound done. And after the ultrasound came back, she said, well, there's something in your bladder. And I was like, what could possibly be in my bladder? So referred me to a urologist, went through that, had the cysto, had the TURP, and here comes the diagnosis. It was a shock because I had never heard of this type of cancer before, didn't have a lot of information about it. And of course, the first thing I did was go to Google, and it was very overwhelming to start. And just an emotional roller coaster with going through, finding out, like I said, I was 30, so that was 20 years ago for me. Just thankful to get the information and to link up with BCAN because that was the only resource I found online that was specific to bladder cancer. So that was the start of my journey. Thank you.
So Monica, you were one of our really early volunteers too.
Yes. Yes.
So that was also, showcasing, I know,
Hold the mic close to you.
showcasing that there are plenty of people that live long and healthy lives after their bladder cancer diagnosis. So that's also partly why we've invited all of these different people. They have different stories. But Monica has been around since before I came on board, so it's really wonderful to have her come back and be one of our speakers today. So thank you.
Thank you.
Hi, I'm Howard Saul. I live outside of Chicago, Illinois, and life was moving along. Didn't think I had any problems. I had some after 60 for men with prostate, but we were watching that a little bit. But I was a little concerned at some of the answers I was getting from the urologist. And I just didn't sit back. I didn't like the answer of, that's normal for a man your age. Being an active adult and kind of knowing my body, between aches and pains of running or doing any sport exercise, I knew it wasn't right. So I moved on and looked for another urologist to speak to just to get another opinion. I didn't feel I wanted to sit back. Went for another opinion, and then I decided to speak to a friend actually who's a retired physical therapist because he worked all aspects, not just bones and shoulders or whatnot. And he made some suggestions, and I started to follow them, and I was also asking detailed questions, more terminology that you would use with a doctor that the average person wouldn't use. And I still wasn't getting answers. And yet when I would change urologists and seek out somebody else, I was told, you don't know what you're talking about. Forget it. Don't worry about it. No, you don't know what you're talking about. And I'm thinking, don't like that answer either. So I started Googling and looking for the doctor that would really, what I thought would listen. And there was actually a clip of this particular doctor. And so I made an appointment, and I got to see him, and he started to monitor a little bit and watch. And I made a suggestion on one thing that I wanted to have done, and it was actually a cystoscope to look. And the week before I was to have the cystoscope is when we were out one night with a bunch of friends, came home getting ready for bed, and I had full-on blood. I looked back at my wife, I said, this doesn't look normal. So by Monday, I called my urologist. They got me right in, and the process started. And here we are 2 years later, and actually 2 years ago yesterday, I had my TURBed. And then within a couple weeks, I found out the diagnosis. And the result was, and the highest recommendation was, is to have my bladder removed. And I knew I just had to move forward. I had the great confidence of the doctor that I had chosen and that I was referred to, and I followed his recommendation. I'm back to biking, swimming. I'm not running as much anymore. I do a lot of walking, but I'm back being active, and I'm loving it.
Thank you so much, Howard.
welcome.
And you jumped right in when we had our fledgling Chicagoland chapter. You came on board with all of that and have been involved with the walk. So you just jumped right in with both feet, and we appreciate that.
I'm also very fortunate that when I went for my consultation, my urologist recommended me to two doctors, one at Loyola and one at Northwestern. The one at Northwestern had a little bio and clip of himself, and we watched that. And I won't say instantly I became comfortable, but I felt comfort. I think this is the doctor. The one at Loyola, awesome doctor. I got to meet him in person last year. He was a great second choice, but I don't regret who I chose. And he handed us a folder on BCAN. And it was very supportive of BCAN. Now, of course, at that time, you're overwhelmed because you're told you have bladder cancer. And like you mentioned yesterday, when he said that, I felt like I was with the Charlie Brown group. All I heard was wah, wah, wah. I watched him do diagrams. I watched his mouth move. But I literally heard wah, 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 wah. Until we got out towards the front desk, he actually said, I do not want you calling the doctor, because if you do, it'll be 3 or 4 months before you get in. Let me know which doctor you choose, and we will get you in. And I was within probably about a week. And very proactive, listened, spent a lot of time with us, and I decided on my journey.
We're glad to have you here.
Thank you. Thank you.
I'd like to read something and tell you a little bit about my cancer journey, and I'd also like to share a message with all you people. My name is Stuart Greenfield. I split my time between Scottsdale, Arizona and the island of St. Croix. I've been to Illinois, Oklahoma, Oregon, Virginia, lived in Alaska, Africa, Indonesia, and now St. Croix. So I like to wander around. I'm here with you today in Philadelphia to share the existential message that was gifted to me over 8 years ago. My experience with bladder cancer, late 4th stage metastatic bladder cancer. When the doctor told me that, I had to ask, what does metastatic even mean? I didn't even know what it meant. When she told me that, I literally got up and started walking to the door. She said, where are you going? I said, I'm going scuba diving. She was the third oncologist that I had seen. The first one, knowing that I'm a big diver, told me if there was any place that I really, really, really wanted, and he really emphasized that third one, wanted to go now. I told him that in 3 months I was going to visit my brother and his family, and he said no. He shook his head vigorously and said no, now. The next day I was able to get in to see the head of the bladder oncology department at a very, very prestigious and highly respected hospital. This was the shortest medical appointment in the history of mankind. My records were sent over to him the previous day, and he was shaking his head from side to side when I walked in his office. I sat down, he looked at me and he says, it's too late, there's nothing I can do for you, go home and get your affairs in order. That's a hard one to take. That was a hard one to take. The first oncologist recommended another oncologist for my treatment. I didn't even know why. Why am I bothering with treatment? But I went and saw her anyways. She was the first one who explained to me what exactly was going on in my body. Some of it I understood, some of it I didn't understand. But all the while, I was just sitting there shaking. When she told me what my diagnosis was, the first one said 2 to 4 months. Second one said, go home, goodbye. And the third one, she said, it's bad, but you can never give up. I didn't listen to what she said. I got up and started walking to the door. She said to me, where are you going? I said, I'm going scuba diving. She says, you can't give up hope. I said, there's no hope to give up. Everybody's told me I'll be lucky if I'm alive in 2 months. I want to go scuba diving. She blocked me from leaving the office. She would not let me get out the door. And frankly, at that point, I don't think I had the strength to turn the doorknob, and I certainly didn't have the strength to argue with her. I listened to what she wanted to do. I started treatment. I had intensive surgery to remove all the tumors in my bladder and ureter. I started treatment. I had a port inserted in my chest, and I went through it just, why am I doing this? There's just no reason to even be doing this. I'd rather be diving. Why am I going through this torture for an outcome that's not going to be good, no matter what? And I kept hearing in the back of my head the 3 words that she told me, never give up. It sounded good, but to actually believe that yourself after hearing what I had heard was very difficult. I kept trying to listen to it. I kept trying to listen to it. And one day I realized that I was not living. I was just waiting to die. And that's not a way to go through life. I realized I had to change my mindset. And to change my mindset, I came up with a new mantra for myself that I say to myself every day. If I wake up in the morning, it's going to be a good day. Maybe not a great day, but it's going to be a good day. And I go on with my day. And that has helped me quite a bit. I started slowly getting back to life. I started reading more, spending more time with friends and family, and starting to accept the fact that I do have cancer, and it's not a good cancer. Well, you know what? Nobody gets through life alive, and I tried to remind myself that. And it took me several years before I actually believed her. It actually took me probably 3 to 4 years. And I finally started falling in place. You know what? Maybe she knew what she was talking about. And I did completely change my mindset. I needed to live with my cancer, not having it being the center of my life or the entirety of my life. I had been wrapped up in my cancer. I said, this is no good. You're going to go get your treatment, and then you're going on with your life. I started diving again. It was great. And now I've reached the point, I'm 8 years survivor. I am on an... Thank you. I'm on an immunotherapy. Sometimes it's not the easiest, but I'm here. I'm here talking to you all. And I want to pass the message on to you, the existential message that was gifted to me 8 years ago. And when you leave this marvelous conference, please take this message home with you. Never give up. I did, and I shouldn't have. I wasted almost 4 years of my life waiting to die. That's not the way to go. You have to believe that every happy ending needs to have a start. And once you start believing in yourself, it's amazing how much easier everything is going to be. Even if, and you have to believe no matter what odds you're given, the odds are in your favor, no matter what. I don't care. I was told I had less than a 1% chance to live. I'm here, 8 years later. Go figure. I can't. I don't even try to figure it out. I'm just a very, very lucky man. So please, all of you out there, I know how tough it is. We all know how tough it is. Never give up. Don't give up on yourself. You can learn perseverance. You can learn how to have hope. It's really, hope is a beautiful thing. So please, please, never give up. Thank you.
Thank you, Howard. I just want to say, we tried to represent really all sorts of stages and diagnoses and length of time to kind of let you know that you're here on the stage with us because there's a piece of you here. And what we're going to ask some questions about how their experience was. I think it will, if we have time at the end, we'll open it up to questions from you all. But if not, they will be here for the break, and you'll be able to ask them questions too. But thank you so much for sharing everything and for your message. I think it's so important and impactful to kind of keep that at the back of your mind. The idea that so many of our pharma partners are working on new options is really exciting. Back when BCAN started 20 years ago, there were not a whole lot of options. They were basically, as Stuart was told, go home and get your affairs in order. And now we have treatment options, more and more that are even trickling down to the non-muscle invasive space. So there is a lot of hope. And BCAN is here for you. And I'm going to let Patricia kind of ask a couple of questions.
Okay. Well, Howard, you talked about the looking at different options in terms of where you will receive care and who will provide that care and some of the qualities that you were looking for. And Monica, I know we had some conversations about that as well, in which you mentioned that you were looking to switch, and in fact you did switch urologists to find one that fit your needs. And so I was wondering if you could talk a little bit about the qualities that you were looking for in a care provider, and what advice would you give us to self-advocate for that?
The qualities I was looking for was someone that would listen, someone that was empathetic, and that showed that they cared. When I first got my diagnosis for the urologist that was treating me at the time, he walked in the room and he said, "You have bladder cancer," and he walked out. And I was just sitting there like, what just happened? Like, what just happened? So I was sitting there for a while, and the nurse comes in, and she said, "Well, we're going to schedule you for more appointments," and went through the series of tests and the TERP and the cysto, and I was on every 3-month surveillance. So like a few days before it was time for me to go back, I would get a call. "He's not going to be able to see you on Thursday. Can we reschedule?" And I'm like, no. Because at that point, every 3 months I went back. Every 3 months the bladder cancer was back. So I was having a lot of recurrence. So I didn't want to chance waiting 4 months, 5 months, or 6 months, or whenever he could schedule me in. And at that point, I just felt like I wasn't important. And I wanted to make sure I was getting the best treatment that I felt I deserved. So I called the office and I said, I need someone else. This is not a good fit for me. And, it's like, well, what's going on? Like, it's just not a good fit for me. I need someone to be more proactive in my treatment. So that's what ended up happening. I switched over within the same treatment center, but just a different urologist. And I got the urologist that I've been working with for 20 years now, over 20 years, and draws pictures like he got down to my level, because like you see these terms and you're like, I don't understand what's going on. But very empathetic, listened, gave me the options, and let me voice my opinion of what I wanted to do. Because in the end, we have to live with those decisions. It's our body, but that's a big thing for me. Advocate for yourself. If they don't listen, find someone that will listen. And it might take 2 or 3 times to find it, but like you said, never give up. Don't quit on finding that treatment or finding that match that's going to give you the treatment you deserve.
Thank you, Monica. So Howard, I was, you walked us through your journey, but I was wondering if you can walk us through your decision-making process on how did you decide, if this was the right surgery for you, and what factors did you consider that made you feel confident in your choice?
Well, I think when I was first diagnosed, again, you're just stunned. I remember us driving home. I know we got home safely. I don't remember and I know the route. I don't remember the ride home. I remember would look over at my wife, and she was just welting up. We got home. I looked a little bit at BCAN, and then I looked at the doctor choices. The doctor that I ultimately chose, because there was a bio on him and a clip that the hospital, whether he provides it, the hospital does it, whatnot. And I honestly have to say that watching that, I won't say comforted me, but started to put me in my place of, okay. And then with him handing me BCAN, I said, okay, I have another resource. I feel like I'm being surrounded, that I'm being watched, that I'm going to be cared for. I didn't know the end result of the journey or where the journey was really going to truly go, but I felt like I had support instantly. The second doctor, there wasn't a lot out on him except a bio in written term, but I didn't get to see how he would perform unless I went for a consultation. We went and met the surgeon that I chose, the first one, and immediately was comfortable. He was the same person in the video as he was in person. And the way he spoke to us, he never rushed us. He asked all kinds of questions. He allowed us to ask questions. And at that point he said, would you like to schedule surgery? And I said, well, I'd like to digest everything we've talked about today. And this was on a Friday. This was the day after Thanksgiving. And I said, I'd like us to digest and talk about it, and I'd like to get back to you. Fine. And he gave me his business card with, I'm on my chart with the hospital. Just let me know what you want to do. We both sat down and wrote our questions out. I had more questions for him. I sent that to him on a Sunday, figuring, okay, Tuesday or Wednesday at the latest, I'll hear back. I get a ding on my phone, and I have a message. He not only said, yeah, no, okay, he had everything, all the explanations in detail to me. And we looked at each other and said, I think this is the doctor. I didn't think I needed, and I highly recommend you think about a second opinion. I don't take that away from anybody. But at that point, I felt I had the doctor I wanted. And at that consultation, he also explained different options for me. We did talk about a neo-bladder, told me the options with that. But because the aggressiveness of the cells to the tumor, he highly recommended, as well as the urologist pointed out, and my urologist did do, and as well as Dr. Meeks did, he did his little diagrams And I said, well, he got through Artwork 101. But they also explained in more of a generic term. He wasn't full of high terms where I was like, oh, what's that? Or let me write that down and then Google it after. And he spoke in very detailed terms to me for me to understand. And within a couple of days, I went back and I told him, yeah, I'm ready to have the radical. Let's go that route. Then his nurse calls and says, you want to do it tomorrow? Like, no. I said, I'd like to get a few things in order. Okay. And then we kind of scheduled a date. And I think it was a week later, if that, I get a call. My wife went out for a walk. I was puttering around the house doing something. And she called and she goes, well, this was a Monday. She goes, we can get you in on Wednesday. Let me call you back. And my wife's coming towards the front door. I said, they want to operate on Wednesday. And she said, we'll do it, but we're not ready yet. So we did end up scheduling a date a few weeks out. I don't regret going the route that I went because I was confident in the doctor. And again, this is not a pitch for Beacon, but I felt that also Beacon was behind me because I was able to go online and have information, cross-reference, and/or if I needed that support 24/7, it was there. It's not an easy journey. It's a scary journey, especially being told you have cancer. But again, there was support there. So he was great. And he is to this day. We go in for my follow-ups. I never feel rushed. He's thorough. He shows me my scans and what he's thinking of or what we're looking at. I get detailed information, and I appreciate that. And it's helping the journey.
And you mentioned the word support. I think that's very critical, and I want to hear from Stuart. Stuart, what was the support system around that you had when you got diagnosed or throughout the treatment?
Can you say that one more time, please?
Yeah, so during your treatment or when you first learned your diagnosis, what was your support system like?
I was in a fog. I was just in a fog. I didn't care. Nothing mattered. I couldn't find any way to find anything good in my head. Everything was negative. I would try to think of someplace special that I'd been to, and all of a sudden I'm looking at a beach or the water in Australia, and then it started pouring rain. It was just a struggle, and honestly, I was just in a fog for the first year. I really just did what I was told, kept my mouth shut, and every time that I was in the infusion chair, I would just ask myself for 6.5 hours every week, I'd ask myself, why are you doing this? You could be diving, you're wasting your time, nothing good is gonna come out of this. And I was lucky enough to have this doctor who just wouldn't take any of my crap, excuse me. She was 5'1", maybe 100 pounds, dripping wet, and I was afraid of her. I confess. So I did what I was told to do, and I just somehow made it. But I was really lucky that I walked into her office, because if it wasn't for her, I'd be pushing up daisies today, and there's no question about it.
Did you have any family, friends, or did you seek external support as you were going through this?
My family was, I think for the most part, they were scared of what the diagnosis was. They kept their distance, which kind of irritated me because that's when family is supposed to be there for you. But I think that they were afraid to talk about it in front of me. It wasn't easy. And the hardest thing that I had to go through with family was telling my 100-year-old father that he was going to outlive me. And that was not easy. That was very hard. So it just was very difficult for me. I just had a tough time. And I had a tough time that I was going to live. I had a tough time that this was all worth it. I kept saying to myself, you're torturing yourself doing this? Go diving. Who cares? Make it your last dive. Go see what's like 500 feet down.
So yesterday, Dr. Handelsman was talking about some different strategy support systems that are around, and I think you mentioned somewhere along the process you saw a therapist, and did you find that helpful?
Oh, I think, although I never ever contemplated suicide, I learned that I can understand that people can be driven to it because it just attacks you from every side. And excuse my beeping. And it was just very difficult. I try to sit back and think about what it was like. I don't even like going there anymore. I try to look at the future. I try to think, okay, this is in my past. One day it's going to come back. I understand that. And I know when it does, my scan's going to light up like a Christmas tree. But I'm here today. I try to make the most of life. And whatever my doctor tells me to do, I do. And that makes it very easy for me.
No, I just appreciate, so many things about your relationship with your provider is so essential. I mean, it's a match that you make for the rest of your life, and you better like who you're dealing with. And so I think that that's really important. And sometimes people will go to a doctor because they think that's all they have, and that's not going to work for them in the long term, but you don't know that you can change and find the right person, the right provider that is fierce and scary, but that is fighting on your side to help you
Absolutely.
with the choices that you have to make, I think is really important. That we've heard 3 very different stories, and reluctantly you found this other person who, has changed your game. And I think that that's really important, that it is okay to find the right person, the right fit for you. What works for one doesn't work for another person.
And if you're not happy with your doctor,
Yeah.
seek out another doctor.
Absolutely.
Get that relationship where you feel comfortable and confident. It took me until, and unfortunately this happened, but I did. I saw, I think, 3 or 4 doctors until I found the last urologist that stopped and listened and watched. And I'm glad that I did find him. The only thing I kick myself is that summer before that I didn't do something even sooner. I mean, I had found him, but should I have gone to Mayo Clinic? Should I have done this? Should I have done that? But I was confident in that doctor at that time, so I know he was observing me and watching. And that's a message to all of you. If you're just not confident, if you have the means or the know-how, or if somebody can help you or escort you to another city, get yourself to a doctor that you're going to be comfortable, that's going to listen. Because some of these other ones, that one day I just remember, you don't know what you're talking about. And that was my first visit with him. And the other doctor that I went back on the portal because I wanted to get those questions, those more medical questions answered again through the other, and that was gone. What'd they do on their portal? They erased it? So find yourself the doctor that you feel is, that you're confident in, that's paying attention to you.
Oh, yeah. Going back to the support component, what has been your biggest source of support?
My spouse. Yeah. The biggest strength. She's picked everything up from the beginning. To the point that sometimes I think if I pick up a Q-tip, wait, no, don't bend over, that's bending over. No, that's too heavy. And I'm like, no, I can pick up the Q-tip. But supportive there, that she goes to the appointments, just, and another thing is if you have an extra set of ears to go with you, extra set of eyes and ears, it's helpful because sometimes, especially at the beginning, you miss things because you're still in a daze. And she's been the strength, she's been the rock. So that, and then family stepped in, actually. My brother, which I was surprised, I mean, we stay in touch, but never so much. I think he called, at least for the first year, almost every day. And, was right there. Now he lives 700-800 miles away, but he was there just checking every day. And then when I broke the news to some friends, they were there keeping in touch, and that support helped.
Monica.
My support, of course, my husband, my church family was there, and as well as BCAN. Because like I said, when I looked for support groups in my area, there weren't any specific to bladder cancer. So those three components definitely helped me get through those tough times. I felt like I was not alone, even though the times I felt like I was alone, but I knew in the background there were people standing there cheering for me and rooting me on. So that gave me that strength, that gave me that extra push to keep going. So very thankful for you all.
Very important. Yeah. And looking back, because now it's been 20 years, right? That's impressive. What would be an advice that you would give to people that are either newly diagnosed or are fellow survivors?
Newly diagnosed, I would just say just research, get all the information that you can, and like you said, take someone else with you, because a lot of times we don't hear what they're saying at that moment because we're so wrapped up in hearing the cancer. Take notes, and even when you go back and look at the information, write your questions down. Go back and get your questions answered. For someone that's surviving after the fact or not newly diagnosed, same thing. Just whenever you're in doubt, ask. If you don't get what you're looking for, find someone that will give you that answer. I was listening yesterday because when I was diagnosed, I didn't get BCG treatment. I had mitomycin C. But I experienced a lot of pain, even just going to the restaurant, just pain, pressure. Didn't know anything about the physical therapy. So that was interesting to hear yesterday about the pelvic floor, the physical therapy. That would have been helpful for me back then. But I didn't know. And just looking over the last 20 years, seeing the advancement in the treatment, seeing more opportunities or more resources that are out there to help people that are being diagnosed with bladder cancer. So it's definitely going up versus going backwards to me.
Yes. The journey is never smooth. It's a bumpy road. Remember my picture of the, bad street in Philadelphia maybe, but it's never easy. It does help to bring somebody, friend or family, along. And, somebody asked something about the term caregiver. That's kind of the common term. But very often you may or may not be physically doing care things like requirements of picking up the Q-tip or whatever it happens to be. But it's a carer, somebody that is with you on this journey if you have one. There are some people that don't have somebody, but it can be overwhelming. And, sometimes you have to give in to just the feelings that you have. And I know as we were planning this talk, Stuart, you mentioned something that struck you at a moment because diving is so important to you. Can you share the story about what you realized one day while you were driving, the one that you told us?
Now, which one was that?
Crying underwater.
Oh.
Yeah.
Scuba diving has been my passion for over 40 years. I've logged on over 4,000 dives. I feel more comfortable underwater than above water. I don't think about my cancer when I'm underwater. It has been therapeutic for me. That's the best way that I can put it. It was always wonderful for me, but it's taken numerous steps forward in helping me accept what's going on in my body. I can't change it. And scuba diving just has been more than ever, like I say, very therapeutic. It is something that I will do until the day that I go clunk. And
Now, you don't have to take up scuba diving, though. This is not what the story is about. Okay, just letting you know.
but it's wonderful. It's just been wonderful. My family, for the most part, they stayed away from me. I felt like they almost thought that cancer was contagious, and that if they hung out with me too long, they might catch cancer from me. So they literally avoided me. Friends, you know, they do their best to try to comfort you, to console you, but they've got their own problems, they've got their own families, they're busy. For me, my journey really primarily has been by myself. I've had to be my caregiver. I've had to be except for one period where I did see a therapist who was just phenomenal, I had to be my own therapist. I had to convince myself that it was worth the fight. And it took a long time for me. But I'm there now, I'm here, I'm still as obnoxious as ever, and I'm proud of that.
And it's okay to have a bad day. It is okay.
Absolutely.
And to know that there is always tomorrow, I think is a big deal. Everybody has really shared some wonderful insights on their journeys as we go through. And I know all of you have so many good things. And for some, Howard, this is not your first summit. And Monica, you came last year to the summit in Nashville. What do you hope that all the rest of the folks here kind of take away from this?
Just to soak in the information, get what's presented to them, come back, because each time, you know, there's different speakers talking about different avenues of things that we experience going through bladder cancer. I think it's just a wonderful platform to be able to come and to be able to share. It's a safe place, getting your feelings out, meeting other people that have gone through what you're going through. Might not have been the same journey, but the same diagnosis. Like I was telling Howard and Stuart, it's like now it's like an extended family. They're in my extended family now. Just having that support from all over is very helpful.
I have to say, I have to ditto that. To have the support, to come here, to see that we are not alone. Our caregivers are not alone. They have someone that they can talk to. And to find the support of what Beacon has to offer has been tremendous.
I have a couple more questions.
Sure. So, Stuart, I wrote down the quote, never give up, so that we all remember that. But Howard, I know you also have a very positive person. And I'm wondering if you can give us some advice on how we can find and sustain hope.
I think you just have to try to remain positive and look forward. I remember being back in the hospital and the day after surgery, and I didn't feel too bad, but the next day I don't do anesthesia well. And then with the lack of eating, and I guess I was not hydrating enough, so I did kind of take a turn, if you will, for a day or two. But while I laid there, I realized tomorrow's going to be better. I know it doesn't seem that way now. Oops, am I not on?
No, I'm having an issue. If you could use this,
Okay.
that'd be great.
I know tomorrow's going to be better, and that's what I had to focus on. Don't focus on the moment. Focus on the future, and that it's going to be better. You'll be stronger tomorrow. It doesn't seem like it today, but it will happen.
Like that, yeah.
Yeah.
Be present.
Yes.
Yes, Monica, do you have anything
For
to add to
me,
that?
it would be just, like you said, staying positive and being aware of your feelings. If you're having a bad day, you're having a bad day. And it's okay for that. But to also give yourself grace, because a lot of times I think we are our worst critics. We're hard on ourselves. And we can, like I said, give ourselves permission to have a bad day. Everything is not going to go as planned. And I'm one of those people where I like to have control of knowing what's going on and being diagnosed it was clearly out of my control. And I just had to ride that wave and trust the physician, trust the treatment I was going through. And I wasn't okay at that time, but in my mind, I was thinking I will be okay, regardless of what the outcome came. And it's also the mental, changing your mindset of how you think about everything.
Which can, it sounds easy, but it can be challenging.
It can be challenging. And I also had to consult with a therapist as well to help me navigate through that. I like to walk. I enjoy walking in parks, just looking at nature. I do a lot of journaling, listening to music. Those were like majorly my coping mechanisms I use to get through those times where I didn't feel like doing anything. So, yeah.
Thanks for sharing. Did you want to add anything else?
There's a wonderful app out there that a friend gave me, and it's actually with meditation and music, and that's also helped calm me. And with anxiety, if you have a little anxiety, and they do have meditation and anxiety music, and at night if I don't sleep well, I'll turn over and I'll put it on if I have my iPad or my phone next to the bed, and that does seem to calm matters down if you're starting to feel a little anxious or you're frustrated that day and having a bad day. And I've actually started to do some meditation with that. I'll take the afternoon and just relax, let it go, and then it brings me that 5 or 10 minutes, brings me back into let's move forward, let's go. And I just tell people you've got to move. I see it on support, and I'm involved in something else, and I just try to get people active. You need to be active. Do something, even if it's walking to the mailbox twice a day. Do that. Just move.
Just move. We moved yesterday a little bit while we
Yeah.
were doing the stretching, yeah.
And that was excellent. And and I said to you, Patricia, and that's important to do something like that if you can find an app or something online. Silver Sneakers has
Yeah.
things like that. And it really is important, even if it's 5 or 10 minutes. Just do something. It will help you. The energy in your body, it will help.
It will. I'm a strong advocate for movement, and we have some resources on our website if you're, looking for things to do. Actually, last month, I believe we had a webinar on movement, and so we'll be posting some of those videos because we have this therapist actually walking through different exercises and very simple exercises that you could do at home. So now, Stuart, can you, I believe you mentioned that you're starting a nonprofit. Can you talk a little bit about the nonprofit?
I decided that about 6 months ago, I decided that it was time for me to give back. That I was very, very fortunate to be here. I was one of the lucky ones. And I really cherished that thought when I had it. And I decided that I needed to give back. So I decided that I wanted to open up a nonprofit. I wanted to be able to donate to the cause. I don't want a penny from this. It's important to me to be able to say thank you to all the people who've been there for me. Not just the medical staff, friends, strangers, you, Stephanie. It's what keeps me going. It really is. Sometimes when you try to do it all by yourself, and unfortunately I've done that too much, you really your engine kind of starts sputtering. And I just try to sometimes say, hey, this is where you're at. You can't change it, make the best of it. As far as the nonprofit goes, I want to be able to, when everything kind of happens, I want to be able to say, I gave something back. I gave something back to the bladder cancer community that is important to me. It's something that it's just satisfying. And I am actually starting a cruise for scuba divers, and I'm going to donate the entire amount of money to BCAN. And it's just, It's just something very important to me. I don't know how I got the idea, where it came from, but one day I was on the phone with an attorney about starting a foundation. And it's giving me comfort knowing that eventually it's going to filter down and really do some good.
Well, we wish you much luck with that, and I think you're might have some new members that will want to join the scuba diving club after
Please
hearing
see
that.
You can go underwater, I'll just swim across the water.
Yeah, yes.
Bye.
I mean, I do go.
But I think the giving back is so important, and all of you give back in different ways. And so, can you speak a little bit more about what you're doing in your own communities to give back? I know Stephanie, we'll start with you, Howard, but I know Stephanie mentioned some of the things you do with the Chicago chapter, for example.
Well, I think it was shortly after my surgery, I knew about the Northwest chapter. We weren't quite a chapter yet. By the end of last year, we became the Chicago chapter for BCAN. But prior to that, I had learned that there was a support group, and I signed on, and whose face did I see? Daryl. Very welcoming to everybody, and especially new people that come on, and I welcome, and I suggest to anybody in their local area or find a support group. That was another source of support and help. Again, realizing I wasn't alone. I will say the first BCAN summit that I attended was still online. You folks did it online. It was the last one I think you did. But I think for the first half hour, I cried. I was in my own home, so thank God I wasn't in front of the public. But it made me realize everything came to a head at that point, and realizing and seeing others are going through it. And then I obviously joined the Northwest Medicine support group, and that was a tremendous help in meeting new people and having the support and finding out more of what BCAN did, and then learning about the summit. And that's just been, it's just been wonderful to be in a support group. So if you don't have one, find one, and there's a lot. I know there was a woman that I had gotten hooked up with. Unfortunately, she did not survive. She passed away a few months ago. But getting hooked up with a female, and she was asking some questions, and I said, well, we need to get you into a female group, because number one, my comfort level and knowledge is limited to none. But I think if you have specific questions, you need to try to get into a support group for women that really can answer your detailed questions, and that you can feel comfortable with. And so anybody I come across that is bladder cancer that's female, I do make them aware that there is female support that I've learned of through even our chapter, and even through Northwestern. And I do feel it's really important, whether you like it or not, is up to you, but find that chapter, or find that support group that will help you and give you comfort.
Yeah, and I think we mentioned that on our website we have a list of different support groups that you can browse. Some are in person, some are hybrid, some are just virtual. And our female-focused support group it meets the first Tuesday of the month, and we have our meeting next Tuesday, actually. I know we're running out of time, but Monica, I know there's many ways in which you're involved and give back.
With the walk, just planning the walks every year in my area. I'm in Richmond. Just bringing awareness, continue to bring awareness to the community and let them know of the signs and symptoms. The urology facility that I was treated with, they also partner with me. They join us at the walk, and the information I get from BCAN, brochures or pamphlets, I always take it there for them, and they pass it out to the people that are being diagnosed. So I get a lot of support from that urology group.
So you get our materials and you
Yep.
go visit and you
Yes.
hand it to them. See,
Yeah.
there's
That's
ways.
what I've been doing. I got extra material, actually. After I did something this summer, I had extra, and then I called Trenny, and she sent me some information, and I decided to go to my local area. I haven't whittled outside a certain range yet, but I'm going to. And there was one doctor that I had visited a while back. His office was really gracious. The nurses were really gracious and receptionists to take the information I gave them. And I didn't feel that they were going to take them
In
put him
Tulsa.
back here. I know of the doctor, and I've heard about him before as well, and I feel he'll give the information out. I said, have that on your counter. As a matter of fact, my urologist didn't have Beacon. I learned through the surgeon oncologist. I went back, we had an appointment out in that building, and I took him pamphlets, and I didn't think she'd put them out right away, and we'd go to turn around. She already had them out. So I'm gonna be a little person that gets out there and just double check their stock. And I'm
Yes.
just gonna restock it.
Restock.
I'm not being paid by Beacon. I'm very fortunate and blessed that they're here for us.
Yes.
We're so fortunate, and that I feel that information needs to get out there. There's one gentleman in my area, I'd never heard of Beacon. He had surgery 15 months before me. I can't kind of get him to the table to open up to Beacon for whatever reason. And I can just mention it. And I don't know why he doesn't want to get on or to find out more about it. But I just got to get the message out.
Thank you for helping us do that.
Yeah, the fact that not everybody is open to being in a room full of people that know what they're dealing with is okay. We're here for you when you're ready for all of that. If by chance you happen to know of a support group that is meeting in your community or meeting online, please be sure to share that information, because we are a national organization. We don't know everything that's happening in all the corners of the country. So we are happy to add it to our website so that others can find what's happening in your community. And remember that our call center with cancer care can also help find resources within your own communities, because that's really what this is all about, building a community of like-minded people that are sharing this journey together, that are sharing the experience and the resources. And change is happening. So much has happened in the last 20 years from Beacon's perspective. And, who would have thought back all those years ago that we would have the options that we have now? And I think it's very exciting. And we always appreciate everybody's enthusiastic support. But thank you so much for coming today. And I want to give everybody a chance to kind of finish up. So, Stuart, do you have any last comments?
Everybody has to do this the way that they feel, go through their journey the way that they're comfortable. What's comfortable for one person probably is not going to be comfortable for the next person. Everybody, you have to know yourself, you have to trust yourself, believe in yourself. And no matter what the odds are, believe that you are going to make it. Have strength, find it from within. And it's just, for me, it's been very cathartic. And I will tell you one more time, please, please never give up. Don't give up on yourself. You're all worth it. When I was diagnosed, they told me I was in less than a 1 percentile of survival of my cancer. I'd like you all to join me in that 1%, please. And remember, once again, every happy ending needs to have a start. So just get going, do what you're comfortable with. People, you're going to hear this from this person and that from this person and this from that person. You have to decide on your own what works for you, what you're comfortable with, what puts the biggest smile on your face that morning. And then you can really look in the mirror and go, you know what? It's working. It's working. So please, never give up. Thank you.
Last minute words?
Well, I think I want to give Monica and Howard to also say a couple of last words. I know we're a little bit over time, but
We have a long break, so that's
Yeah.
okay.
Just also piggybacking on what you said, Stuart, just that mindset and knowing that you have resources or options out there. Do what's best for you. Listen, take notes, ask questions, and just give yourself grace. I think that's the biggest thing for me, just giving myself grace when those days are not easy for me, and just learning to find the joy in a day. Even if you reflecting back on something years back, just thinking on those things that bring you joy.
And I think just move forward. Get your feet out of bed, exercise, move forward, look at the sunshine, look at the rain, just be happy, move forward.
Thank you all three for being here with us.
So we scheduled a long break for you all to have a chance to talk to our speakers and also to each other. This is so important. We will be starting the next session with Dr. Gadisapur about ERAS, the Enhanced Recovery After Surgery. That whole program, again, nothing to do with Taylor Swift. So we'll be coming back to talk about this because it is important. There's so many surgical things that go on with bladder cancer, from a TURP all the way through the radical cystectomy and beyond. So we will be talking about that, and then we're going to finish up the day after lunch with the things that get our doctors excited. There's so many things newly approved, coming on the near horizon, and also the clinical trials that get them excited about being here every day with you all. So we have a very full agenda for the rest of the day, and now it's time for a break.